Okay, so this is our Medicare Monday series for 2021 with Medicare basically changes for 2022. So we're going to start this evening with the Social Security Cost of Living Index or adjustment. Some of you may have already heard that this is the largest increase in cost of living adjustment that Social Security has had in 4 decades. So it will be 5.9% in 2022. The important thing about that is that the Social Security Cost of Living Index usually is what drives the increase, if you will, in your Medicare Part B premium. And so that's why we always pay attention to that as we are looking at Medicare changes for 2022. So the most important thing that I can share with you tonight is that Medicare has parts, and what we supplement Medicare with is plans. So it's important that you keep those straight in your mind. So Medicare has parts A, B, C, and D. What Medicare doesn't cover is covered by plans, and we have Medicare Advantage plans, or Part C. We have Medicare prescription drug plans, or Part D, and we have Medicare supplements, which are, sorry about that, Medicare supplements, which do have plans A, B, D, G, J, or K, L, M, and N. And because some of those are duplicates with A, B, C, we find that people oftentimes get confused. So Medicare Part A is inpatient care, hospitals and rehab, home care, as well as hospice. So the cost of Medicare Part A for 2022 has not been released. Now, for most people, Part A is free. If you have paid into Social Security for 40 quarters, or you have been married to a spouse who has paid into Social Security for 40 quarters, Medicare Part A is free. Individuals who have paid in 30 quarters to 39 quarters will pay $259 in 2021. And if they paid into Medicare or Social Security for less than 30 quarters, this year the premium was $471. Primarily the people who end up having to pay into or pay for Medicare Part A is actually at this point in time some federal government employees who did not pay into Social Security. A number of years ago, Medicare or the federal government started to require that Medicare, that federal government employees pay for Social Security or pay into Social Security. So Medicare Part A has what we call a deductible benefit period. The deductible benefit period is 60 days. So you have to pay a Part A deductible, which in 2021 was $1,484, has not been released for 2022. So this benefit period goes, say you had to go to the hospital today. Today is November the 1st. If you end up having to go back to the hospital on January the 31st, you would not have to pay the new deductible because you would be in the same benefit period. If you have to go back to January 1st and December 31st. So let me do that example again. If you have to go to the hospital on December 31st you would not have to pay for that benefit period again. If you had to go on January the 2nd, you would be in a new benefit period and you would have to pay the deductible again. Now, this deductible not only covers your hospital stay, but it also covers your skilled nursing or rehab stay if you go in for rehab. The coinsurance then, if you have to stay in the hospital for more than 60 days, which is your deductible period, in the hospital, it's $371 this year for days 61 through 90, and 91 days or more are $742 per day. Most of the time, those charges are covered either by your Medicare Advantage plan, or they are covered by your Medicare supplement, or if you are low income, they are covered by Medicaid. In addition to your regular days in the hospital, Medicare also gives you 60 lifetime reserve days, and Medicare will pay all of those. Medicare Part A benefits, so hospital inpatient coverage, mental health inpatient coverage, skilled inpatient rehab, this is usually in a nursing home, skilled home health can be either a Part A or a Part B coverage, and hospice care. So those are the 5 different types of care, if you will, that are paid by Medicare Part A. In order for Medicare Part A to pay, you have to be admitted to the hospital as an inpatient. This means that you have to be an inpatient for 3 midnights. So it's important for you to know whether or not you are an inpatient or an outpatient. In an emergency room, you are an outpatient. Sometimes people basically are in an outpatient status for more than they might realize. But what happened a couple of years ago is that Medicare basically said that to hospitals, if you are going to keep someone in the hospital for more than 24 hours, you do have to admit them as an inpatient. And the way you as a patient know that you are an inpatient is that they will bring you something called a MOON, or a Medicare Outpatient Observation Notice, which tells you that you are being either continued as an inpatient or as an outpatient in the emergency room, or they will tell you that you are being admitted as an inpatient. The other thing is that when you are an inpatient for 3 midnights, this then makes you eligible for the Part A home care as well as the skilled rehab. When you are ready to be discharged from the hospital will then ask you to bring something called, or to sign something called an important notice from Medicare. This is basically the document that says that you are ready to be discharged and ready to go to other levels of care, either home or to skilled rehab. When you get this important notice from Medicare, or they bring you the form that tells you that it's time for you to be discharged, if you, for some reason or other, believe that you are not ready to go home, it's not safe for you to do that, you can ask the hospital to file something called an Expedited Appeal. When you ask for that, the hospital basically has to keep you for up to an additional 72 hours. Your case is reviewed by a third-party vendor, and they make a decision at that point in time as to whether or not you can stay another day or two. Usually what happens during that period of time is that your condition improves and you are then in fact able to go home safely or to be discharged to a skilled rehab facility. The other thing that the hospital is required to do is that they are required to confirm with you whether you are an inpatient or an outpatient every day. When you go to a skilled rehab facility, as I said a moment ago, you have to have been in the hospital for 3 days as an inpatient, 3 midnights. You also have to have something called skilled care. Skilled care means that you need help with things like strengthening, you need physical, speech, or occupational therapy, you need respiratory therapy, you need wound care, you need skilled nursing services. Someone who just needs long-term care because they are unable to take care of themselves would not be eligible for Medicare to pay for any of their stay in a skilled rehab facility. The cost for basically going to a skilled rehab facility is days 1 through 20 are covered by Medicare. You pay nothing. Days 21 through 100, if you pay $185.50, this is in 2021. We expect that that will go up in 2022, but we do not know how much. If you have a Medicare supplement, days 21 through 100 are paid. If you have a Medicare Advantage plan or a Part C, you will have to pay that $185 out of your own pocket. There is no coverage available. If you are on Medicaid, Medicaid will pay those costs. If you are in a skilled rehab facility and need skilled care for more than 100 days, on day 101, Medicare pays nothing. Now, some people will continue to get Medicare services after day 100 in a nursing home, but those will be under their Medicare Part B. The third part of Medicare Part A is home health care. Again, as I said, the requirement is that you have to have a 3-day hospital stay. You need skilled services, very much like you needed in a skilled rehab facility, but you must be homebound. They will be delivered in your home. The definition by Medicare for homebound is basically that it takes an extraordinary amount of care for you to be able to leave your own home, and that it that is basically unsafe for you to leave. The cost of home health care is zero. So home health services, therapy, skilled nursing, or whatever, those are all billed to Medicare. The last coverage for Medicare is hospice care. In order for you to receive hospice care, you must have a terminal diagnosis that you will live for 6 months or less. You first are approved for a 60-day benefit period. You can be approved for an additional 60 days and then 90 days. If you are continuing to decline in your health, that can be extended beyond the 210 days for a hospice services. Sometimes people are also discharged from hospice because they continue to improve rather than their condition to be declining. The costs for the hospice services themselves are zero. The hospice related prescriptions, the cost is $5 per prescription. And for respite care, should you go to a nursing home for 4 or 5 days to give your loved ones a little bit of a break, or should you have respite care come into your home for 5 days or less to give your loved ones a break, the charge would be 5%. If you are in an assisted living or if you are in a nursing home, you will pay 100% of the room and board charges in hospice care. So let's switch now to Medicare Part B, which is outpatient services. Medicare Congress has also not announced the Medicare Part B premium for Social Security for 2022. All of the pundits are telling us at this point in time that it will probably be $158.50. This is basically based upon the increase in the COLA, or the cost of living increase. Now, the premium will probably be $158 if your income on your adjusted gross income based on your 2020 income tax filings is $91,000 or less if you are a single person, or $182,000 or less if you are married. So what happens at this time basically is that if you are a higher income earner based on your 2020 taxes, you could then have to pay an additional premium for both Part B as well as your Part D premium for prescription drugs. That is totally, though, only for people who make higher income brackets, or in higher income brackets. Now, if you are like a situation I just recently had, we had a couple who the husband received a very significant severance pay in 2020. So they did get into the higher income earnings bracket. She was also working in 2020 as well as 2021, but she was retiring. So rather than to have them pay the higher premium for 2022, when they are both going to be on Medicare, you can fill out a form, contact Social Security, not Medicare, but Social Security, and have your Medicare Part B recalculated based on current earnings rather than based on your 2020 income tax, should you have made a lot of money for some reason or other. The Medicare Part B deductible, Congress has also not announced that. It should be noted that the Medicare Part A and B premiums, deductibles, and co-insurance all require an act of Congress. The Centers for Medicare and Medicaid Services, or what we commonly call Medicare, are not allowed to make those decisions independently. They do have to be approved by Congress. The projected deductible for 2021 is $217. That is paid only once a year, and it is paid on the first $217 of coverage of services that you receive in 2022. Sometimes one of the things that happens, and I'm seeing this more and more with both doctors as well as other Part B providers, is that they are asking you to sign something called an advanced beneficiary notice of non-coverage. What this basically means is that if the provider either believes, or if they just want to make sure that Medicare may not cover this particular service that you are having, they are asking you to sign this advanced Medicare beneficiary notice, and that makes you personally responsible for those charges. Other charges that come with Medicare Part B, in addition to the Part B deductible, are some out-of-pocket expenses. Medicare pays 80% of the approved charge, not the billed charge, but the approved charge. Medicare's rates usually are much less than the providers, much less than the doctor's office, much less than the labs, much less than the ambulances, the emergency rooms, any of those providers. Medicare then will pay 80%, you pay 20. And this can either be paid by you, can be paid by Medicaid if you are low income, or it can be paid by your Medicare supplement. If you have a Medicare Advantage plan or a Part C, instead of paying the 20%, you will pay an out-of-pocket copay. Could be $10, could be $20, could be 20% of whatever the charge is. If your provider, your doctor, accepts what we call assignment, then all the doctor will get paid is the 80% that Medicare approves and the 20% that either you pay, Medicaid pays, or your Medicare supplement pays. The doctor, though, can charge what's called an excess charge. That is limited to 15% of the Medicare approved charge, not of the billed charge. So let's take an example. Let's say that you go to the doctor, he charges $100. Medicare approves $70. So Medicare is going to pay 80% of the $70 or $56. You are going to be required to pay 20% of the $70 or $14. If the doctor accepts assignment, then he will accept the $56 from Medicare, your $14, or a total of $70. If he does not accept assignment, then he can charge the 15% excess charge, which is an additional $10.50. There is no limit on the annual amount of Part B charges that you are responsible for or that Medicare will approve. So if Medicare approves it, you're always responsible for the 20%, or it will be paid by Medicare, Medicaid, or your supplement. So this is a very busy slide, but I wanted to show it to you basically because there are a lot of services that Medicare Part B will cover. They not only cover doctors, labs, and x-rays, which most of us are familiar with, but they also cover things like preventive services. They'll cover an annual wellness exam. They cover advanced care planning. They will cover some special things for diabetics, for people who have heart issues. So they cover a large number of different services. They also now will cover telehealth services, and doctors who use telehealth services are allowed to bill exactly what they would bill if in fact they were seeing you in person. This makes the incentive for doctors to use telehealth very good. And a lot of doctors like it because they are able to really see their patients without worrying about having them come into the office. During the pandemic, Medicare also started paying for all of the COVID-19 kinds of services. So if you had monoclonal antibody treatments or any other COVID-19 antibody testing, vaccines, all of that can be paid for by Medicare Part B. And that is one of the reasons why you were asked or are asked to bring your Medicare card if you are having any Part B or having any COVID-19, either testing or vaccines. Another thing that we want you to know about is the issue of immunizations. As most of you know, Medicare can never do anything simply. So they always have to make things complicated. So if you get immunizations, some of them are paid by Medicare Part B, but some of them are paid by Medicare Part D, your prescription drug benefit. So flu shots, pneumonia shots, and hepatitis B shots are all paid by Medicare Part B, and you can get them at the doctor's office, a community clinic, or your pharmacy. If you get a shingles shot or a Tdap shot, you want to get that at your pharmacy because those are prescription drug plan or Part D coverages. Your doctor's office is not going to be a Part D provider, so it will be out of network, so they will charge you the full price for those. So it's important if you want to get a shingles vaccine or a Tdap booster that you have that done at the pharmacy. Let us switch now to a Medicare Advantage plan or Part C. So we are now in what's called open enrollment. Open enrollment only is important for Part D and Part C. Open enrollment does not matter for Part A or for Part B. You do not care about it. During open enrollment, which runs from October 15th through December 7th, with coverage to start January 1, 2022, is important if you want to enroll with a Medicare Advantage plan or change, or if you want to enroll or change in a Part D plan, which is a prescription drug standalone plan, or your Part D plan might also be part of your Medicare Advantage plan. Sometimes it is, and sometimes it is not. Last year in 2022 or 2020, Medicare announced something called the Part D Senior Savings Insulin Model. And this is often confused by diabetics who are insulin dependent with the Colorado insulin benefit. The Colorado insulin benefit only works for Medicaid beneficiaries and for people who are enrolled in the Marketplace or the Affordable Care Act. It does not have anything to do with you as a Medicare beneficiary. As a Medicare beneficiary, you are covered under the Senior Savings Insulin Model. The way that that works is that you basically get the first vial of insulin for $35. The second vial of insulin of the same insulin type, you will pay whatever the copay is on the tier on your Part D plan. If you need more than one vial of the same drug, you pay the full price. If you have two different types of insulin, say you have a Novolin and another type, then you would pay the $35 on the first vial on each one. There are 8 prescription drug standalone plans that offer the senior savings model, and 48 of the Medicare Advantage plans offer this coverage. If you buy a basic coverage, it does not include the $35 benefit. If you buy the enhanced, it does give you the $35 benefit. Medicare Advantage plans have 5 different types of plans. We have what's called an HMO, which is the one that is a health maintenance organization, and the traditional one that most people are familiar with. In a traditional HMO plan, basically you are in network, you use their providers. They do a lot of work in terms of care management. Usually you have to have a referral, and frequently they will add on benefits. So they have to offer what Medicare Part A and B offer, and then they will add additional coverages. These additional coverages oftentimes include things like transportation, prescription drug, or vision, hearing, and dental services. Some of them are offering meal plans after hospitalizations. Most of those benefits, though, are negotiated every single year. So whatever they're offering in 2021 may look very different in 2022 and in 2023 and then forward. The preferred provider organization is another type of Medicare Advantage plan. It is not as common, if you will, as the HMO plan. More frequently offered outside of the Metro Denver area, although there are a few plans in the metro area. The primary difference between an HMO and a PPO, or preferred provider organization, is that you can go outside the network. And what happens then is basically you pay the 20% copays all out of pocket. The network or the Medicare Advantage plan pays what Medicare would normally pay, but then instead of taking advantage of their copay structure, you pay Medicare's 20% copay structure. The private fee-for-service plan is one that there are relatively few of these offered in Colorado, but there are a few. The private fee-for-service model works very differently than the HMO and the PPO. The private fee-for-service model has an inpatient benefit, or I mean an in-network benefit, so you can go to the network, but the provider, the network, is able to decide whether or not they are going to accept the Medicare Advantage plan's payment as payment in full or with some type of a copay for the procedure that you are currently having done. They also can accept you today for whatever your office visit is or the procedure, but 3 months from now, they can elect not to accept you or the payment. They'll accept you, they just will charge you full price and not accept the Medicare Advantage payment. So I see that as having a lot of disadvantages, if you will, in terms of care. They also do not do as much in the way of coordinated care, and they frequently don't have all of the add-on benefits. The special needs plans are specifically designed for a specific type of either condition or group of people. So a special needs plan may be for Medicare beneficiary or Medicaid beneficiaries. It may be for heart conditions. It may be for dialysis patients. Special needs plans usually have a relatively rich benefit. They may or may not have a premium, and they frequently do not have out-of-pocket costs, if you will, to the client for any of their copays. The DSNPs, or dual special needs plans, are specifically designed for the Medicare and Medicaid patient or Medicare beneficiary. These offer a very rich benefit, and that most of them have a zero copay, they have a zero premium, and they have a lot of additional benefits over and above the Part A and Part B benefits, as well as the Part D benefits. All of these Medicare Advantage plans have a zero premium program this year. So we have 10 companies, if you will, that are offering services in Colorado this year. All of them have at least one zero premium plan. The ones with the little cross also participate in the senior savings insulin model. Another thing to know about Medicare Advantage plans is that they receive star ratings every year from Medicare. A five-star rating is the best that you can get. The only company in Colorado that has that a 5-star at this point in time is Kaiser, and they received that in 2019. It was continued in 2020 as well as in 2021 because of COVID. Not all plans are offered in every zip code in the state of Colorado. The majority of these plans are offered along the Front Range, but there is some expansion into more counties and more zip codes in Colorado. So for example, for the first time, United Healthcare is going to be offering services in Garfield County. There are also a couple of other companies that are now going to be working on the Western Slope, and a couple that have expanded their service area to the Eastern Plains, or some parts of the Eastern Plains. Most of the Part C plans also have the Part D included as an embedded benefit. So let's switch our attention now to Part D, which is the prescription drug benefit. Every single person is encouraged to review their Part D benefits for the upcoming year and to make a decision as to whether or not they want to stay with their current plan. So the Part D coverage is basically offered through private standalone insurance companies. Many of the insurance companies that offer Medicare Advantage plans also offer a standalone prescription drug plan. The premium for your Part D plan can be deducted from your Social Security check. That is an easy way to have it done so that you don't forget to pay the monthly premium. This is now what's called open enrollment between now and December 7th, 2021. And any changes that you make, basically that coverage will start January 1, 2022. Medicare Part D has a standard benefit that Medicare approves. These particular companies do not have to, in any way, shape, or form, follow this standard benefit. So they can change the standard benefit in any way that they would like. So the annual deductible for 2022 is going to be $480. This is an increase from 2021 of $35. What this means is that for the first $480 of prescriptions that you receive in 2022 will be your responsibility unless the company changes that deductible and lowers it. Some of them do or have done that or will be doing that. Some of the drugs that are on a tier 1 also may not be subject to the $480 deductible, again, depending on the company. The second tier then on the Part D benefit is what's called the initial coverage limit. This means for the next $4,430 of cost of the prescriptions, and this is the retail price. This is what the pharmacy would charge you if you did not have Part D. You have to pay 25% or $1,107 approximately. Once the retail price of these drugs reaches $4,430, you go into the third level, or the donut hole. Basically, there was a lot of talk a few years ago about closing the donut hole. What that means basically is that the insurance company or Medicare pays all but 25% of the cost of the drugs up to $11,000 and $480 this year. So when the price of the drugs at the pharmacy, cumulative, the deductible, the initial coverage gap, and the donut hole, when they get to $11,480, basically when all of that happens, you go into what's called catastrophic coverage. And when you get into catastrophic coverage, what that basically means is that your copay is going to be significantly less. So in 2022, if you need generics in the catastrophic level, you pay $395 for a generic drug if the retail price is under $79. If the retail price is over $79, then you pay 5% of the retail price. For brand name drugs, basically it's the same thing, except that you will pay $9.85 for brand name drugs under $197 and 5% for the cost of the drugs over $197. So these are the 8 companies that are offering Medicare prescription drug plans for 2022 in Colorado. So as you can see, there's some significant overlap. Aetna, Anthem, Cigna, Humana, Mutual of Omaha, United, and WellCare. Elixir is new in the Colorado market this year. The ones with the little crosses are also participating in the senior savings model, and their star rating, similar to the Medicare Advantage plans, did not change. None of the Part D plans doing business in Colorado have a 5-star rating. The majority of them have somewhere between a 2 and a 3. If any of you have Express Scripts Part D plan, prescription drug plan, they are leaving the marketplace in 2022. What this means is that you will need for absolutely sure to find a new company for 2022. So if you are enrolled in Express Scripts, you will need to definitely change your current plan. Or the other thing you can do is you can also enroll with a Medicare Advantage plan that has prescription drug coverage. Either way, one of the things that you will want to do is to either do it yourself at medicare.gov and check with the Medicare Plan Finder to get the costs of the drugs for the new company that you're enrolling in, or if you are changing. There's been a lot of change in pricing this year, so it would be well worth your while to check for the drugs that you are currently on to see whether or not they are still at the same level and if there's any changes expected to your out-of-pocket costs. The most effective premium this year, there's a $5.50 per month plan through WellCare. The most expensive plan is a $103 plan through AARP. The average for Colorado for this year is approximately $40 per month. So the premiums have increased quite a bit based on last year. The other thing that you will want to pay attention to in terms of when you do the plan finder is what tier these plans are on. So if it's on a tier 1, most of those are the older generics. Usually there's a $1 or $2 copay. And if most of your drugs are on a tier 1, that should be okay. If they are on a tier 2, usually they are a generic as well. There's usually a copay, but it could be a little bit higher. A tier 3 and 4 are usually what they call preferred and non-preferred brand. The preferred basically, again, are brand name drugs that have been around for a while. The non-preferred drugs usually are the newer drugs that cost the company more to purchase, if you will. And then we get to tier 5 and 6, which are often called either specialty drugs or select drugs. These are the newer drugs, the ones that have most recently been released on patent. Oftentimes you can see your copay as high as 50% of the cost of the drug. It's also important for you to know that not all drugs for all companies are on the same tier. So for example, United might have a cholesterol drug of Mevacor on a tier 1, where Aetna might have it on a tier 2, and Anthem, Blue Cross and Blue Shield might have it on a tier 3. So again, it's important that you check what tier they're on and what your out-of-pocket cost will be. You also can see those changes from year to year. So if you had a Humana this year, the drug that was on a tier 1 for 2021 might not be on a tier 1 for 2022. There's also variation in terms of what pharmacy you use. So you can see a price difference if you use a Walmart versus a CVS versus a Dillon's or Kroger or City Market in some of the more rural areas. The Part D plans are required to cover every zip code in the state of Colorado. So just because the Part C plans pick and choose what zip codes they are going to offer, the Part D plan, once you select it, is available regardless of your zip code. The other thing to think about or to know about in terms of Part D or prescription drug benefits is what we sometimes call restrictions or limitations. And there are 3 of those. One of those is called quantity limits. This means how many pills will the company pay for each month that you take. If you have a drug that is subject to quantity limits and you're taking 1 or 2 or 3 pills a day, I don't worry too much about it. If you're taking 5 or 6 pills a day, then that is much more concerning, if you will, in terms of whether or not they would pay for as many pills as your doctor prescribes. The second limitation or restriction is what we call prior authorization, or a PAR. What this means is that every time your doctor prescribes that prescription drug, they will be required to check with the prescription drug plan to get authorization and approval to get it filled. Doctors are not very happy with those types of drugs because it takes extra time for them, or they have to search for a different drug than the one that they were hoping to be able to use. And the third issue that you need to be concerned about is step therapy. And step therapy basically means that if your doctor prescribes a drug and the company can require that you use a different drug, or that, and if it does not work, that you fail on it before they will approve the drug that your doctor approved. Now, if you are subject to step therapy and you stay with the same company, you don't have to do that from year to year. If you have a drug that is subject to step therapy and you switch companies from year to year, then you can be subjected to step therapy year after year. The last thing to know about prescription drugs is that companies have the ability to change their formulary every 2 weeks. You get to enroll once a year. They get to change the drug every 2 weeks. If they do change the drug, they do have to give you a 60-day notice that they're changing the tier or that they're dropping it. So that gives you time to contact your provider to be able to hopefully identify a different drug that can be helpful in terms of your treatment. So that is what we have at this point in time for Medicare Parts A, B, C, D. As I said at the beginning of the presentation, if you would like more information about the different parts, we do have on our website, also on our YouTube channel, a session on more of a tutorial on how to enroll in Medicare Part D. We also have a presentation on the difference between Medicare Advantage and Medicare supplements if you're looking to make that decision. We also will be doing future sessions on telehealth. We'll be doing them on Medicare and Medicaid, and we'll also be doing them on the app that Medicare has and their website services that can help you manage your Medicare benefits online. You can request a resource packet if you want to put in the chat, not in the chat, but send us an email at cogs@senioranswers.org with your name, address, and telephone number. We're happy to send you a resource packet. If you want to come by our office on November 8th or 15th, between the hours of 8 and 5, we do have resources on the porch. You can grab a bag and you can fill it with basic information about our agency and other Medicare resources. We do have some information available in Spanish as well. Our offices are located at 1129 Pennsylvania in Denver. You can park in the driveway, just pull in, just run around up on the front porch, and the information is sitting there, and you're welcome to take whatever is of interest. If you're coming and you have a friend who could benefit, please feel free to take a second packet as well. We also are offering individual counseling. You can register for a counseling appointment once you get the slides virtually, as well as in the email. It will give you the link to sign up for the counseling appointment, or you can give us a call. The kinds of things that we can help with through our Medicare counseling, you can ask questions about coverage. You can ask questions about prescription drugs or Medicare Advantage plans or Medicare supplements. If you're new to Medicare, you can also ask for an individual counseling session. So just about any question that you might have related to Medicare, we can help you with. For counseling and support, you can call our toll-free number at 1-855-293-6911, or you can call our main number at 303-333-3482. We also have counseling available in Spanish, and that number is 1-855-880-4777. So again, those telephone numbers are 1-855-293-6911 6911 is toll free. Our main number is 303-333-3482, or our Spanish line is 1-855-880-4777. You can also get a lot more information at our YouTube channel. All of these sessions are being recorded. And if you just Google YouTube Colorado Gerontological Society, there are a number of different playlists, not only on Medicare, but also some of the other services that we offer, which should be helpful to you. And you can also visit our website at www.senioranswers.org, and that can also be of benefit to you if you have additional questions. Thank you for joining.